Hospitals are facing a fiscal crisis. Did you know that for every dollar a hospital spends on air filters, it spends $6 in electricity to push dirty air through those filters? Are group purchasing organizations, integrated suppliers, or just old-fashioned buying habits dictating that you purchase by first cost? Is this really delivering value? Or increasing your total annual facility expenses? Not to mention the risk you are taking when products don't deliver clean air and aren't operating within compliance guidelines. That business model is not total cost of ownership. It's time to change that way of thinking because it's costing you significant dollars each year. Let's begin with air filtration. Hospitals are facing enormous challenges. Reduce operating costs, reduce risks for patients and staff, and maintain compliance. Camfil premium air filters address all of these challenges. Although they have a higher initial product cost, they provide a significant reduction in total cost of ownership. Premium air filters can reduce HVAC energy cost by 20%. Additionally, premium air filters last twice as long as traditional air filters, reducing installation labor cost by 50% and waste disposal cost by 70%. For hospitals, every dollar saved in energy is the equivalent impact on operating margin of a $20 increase in revenue. Camfil's energy-efficient and longer life air filters typically save hospitals tens of thousands of dollars each year. For large energy-intensive hospital facilities, it is reasonable to experience six-figure savings in annual spend. Here's how. A filter's job is to take dirt and dangerous particles out of the air and maintain efficient airflow in your building. When using a low-cost filter, it will clog more quickly, causing a higher resistance to the airflow. Your biggest savings is in energy cost, because by selecting a filter designed for lower average lifetime resistance, your HVAC unit doesn't work as hard to pull air through the system. A Camfil air filter captures particles and maintains the proper airflow 2 to 3 times longer than a low-cost filter and requires less frequent filter changes. To learn more, let's take a closer look. Really close. A low-cost filter uses coarse fibers and loses particle efficiency quickly. A Camfil filter features fine fibers that capture far more contaminant and much smaller particles, yet maintains high system airflow. Improved indoor air quality lowers transmission of nosocomial or hospital-acquired infections. With improved indoor air quality, you greatly reduce that risk for patients and staff in all healthcare spaces, from patient rooms to surgery suites. Compliance guidelines state a minimum particle efficiency rating for air filters in all healthcare areas. Low-cost filters can quickly lose their particle efficiency, which means they operate most of their lifetime outside of compliance guidelines. With Camfil air filters, you get guaranteed benefits not available from any other supplier. We can demonstrate actual savings by evaluating your current HVAC system using our life cycle cost software that leverages over 20 years of experience and data analysis. You'll see for yourself how Camfil filters are an important part of your energy plan, total cost-saving strategy, and commitment to sustainability. And the longer you use Camfil, the more your savings will increase. In fact, if our competitors' filters were free, it would still cost you more to use them. Your Camfil representative will get you started.